Olivia.
Hi, Kat.
How's it going?
Good, you?
I'm good. Thank you for filling out the Westry questionnaire. That'll give you a little bit more info about your symptoms and how you're feeling in your everyday life.
No problem.
All right, so based off that, I know that you've got low back or pain a little bit lower in your back. Do you want to just tell me about that? What was the main reason you're coming in?
Yeah, exactly that. Pain, like, almost like in my sacrum area. It's really
Okay.
Right.
It's like really low in your back?
Really low, exactly, and on
Okay.
the right side.
So is it more on your butt, you would say then?
Not
Or, like,
lower
in
my butt, it's
between
really like near the bone. Like I can feel it.
Okay.
In the bone, in between my pelvis and my sacrum.
Okay. All right, and can you tell me how that happened? Like how that?
It started when I was like 14, I think.
Okay.
I was playing futsal, and basically me and the goalie went up at the same time, and she hit me, and I fell, and I landed right on my butt.
Okay.
And then that was the first time I felt the pain.
Okay. Were you able to keep playing?
I did keep playing.
Okay.
Yeah. Then I think about a month later, maybe it was a long time ago, so it's kind of the beginning is a little bit foggy.
Okay.
But then I started my flag football season after that, and I still felt it, but it wasn't so bad. And then I went and twisted to get my groceries to get my flag, and then the pain was a lot sharper, and then I couldn't play because I couldn't really walk. And that was maybe a month after I had landed.
Okay. And after that, you weren't able to.
And after that, no, I wasn't able to play. I went to go see a physio.
Okay.
And what did we do together? We did a lot of stretching.
Okay.
She would release my glutes. Anyways, after I saw her, it was a lot better. But since then, it comes and goes depending on the movements that I do.
Okay. And what movements would you say make it come or make it go?
Single leg glute bridges.
Okay.
Single leg RDLs. Heavy squats.
Okay.
Heavy deadlifts. And biking. Being on a bike for a long time, like after an hour.
After about an hour?
Yeah. I'll start to feel it, and then I'll progressively get worse the amount of time I'm on a bike.
Okay. And you don't stop, you just continue?
Like if I'm on the bike like this, and I turn, like sometimes I'll be clipped in and I'll turn my leg out, and that'll kind of relieve it for a bit. But you can only do that for so long. You kind of gotta get home. So. And I just keep biking, but yeah, there's nothing really to. But like after workout, maybe like if I stretch to the opposite side,
Yeah.
I feel it kind of open up.
Okay.
Makes it feel a little bit better,
So that
but it still
relieves
goes
it.
away. That relieves it while I'm down there. But as soon as I stand back up, it's there again.
Okay. So you said it was on your right, so when you go down, when you rotate towards your left, it relieves the pain?
Yes, exactly. Vacuuming also hurts.
Okay. You said vacuuming also hurts?
Mm-hmm.
Is it that same, like twisting motion that's painful?
Yeah.
So is it twisting to your left?
Yeah.
Okay.
Yeah. I'm like making sure.
Do you feel it like right away when you start, or is it like after a couple movements?
After a couple, maybe
After a
after,
couple.
I don't know, 10.
Okay.
I'll start to feel it, and once again, it progressively gets worse until I have cleaned the house or something.
Okay. What would you say the pain is like when you're vacuuming?
It's very uncomfortable. Maybe like a 2.
A 2? And,
or 3.
and what kind of pain is it? If
Very
you were to describe
dull.
it. Dull?
It's dull. It feels like an ache. It feels
Dull,
like everything
aching.
is compressed in that
Like
area.
stuck kind of?
Yeah.
Okay. Not sharp or radiating or
No.
pulsating or anything like that? Okay. And when it first happened, both times when you were 14, do you remember if like the level of pain that it was and what it felt like? Or not really?
The first time when I landed on my butt,
Yeah.
no. When I twisted,
Yeah.
that hurt. Maybe that was like a 5. Like I
5?
couldn't walk.
Okay. And you couldn't walk after? Did that last only for the rest of the day or for?
No, that was like a couple days. I remember
Okay.
I saw physio pretty soon because, like I said,
Yeah.
couldn't walk. And then when I left her office for clinic, then I was able to walk after, but it was very stiff. very stiff.
And were you ever diagnosed with anything?
They basically said that I landed on my pelvis, and then it kind of shifted a little bit out of place. So in between my sacrum and my pelvis, it kind of moved, and then it got all
Okay.
inflamed in the joint, and that's what was causing the pain. That it was inflamed.
Okay. Do you remember if they mentioned anything specifically? Did they say you had an upslip? Does that ring a bell, or nothing much? It was just
It just said that movement caused inflammation in the joint, and that was
okay.
it.
All right. And did you ever have any other problems in that area before?
No.
Did you ever have any type of orthoscopic problems? So any fractures, sprains, strains?
Yeah. I used to strain my quad a lot.
Oh, okay.
My
On the right?
no, my left.
On the left?
I used to strain my left quad a lot. When I was younger, I
Okay.
have a left MCL sprain, first degree, and I've sprained both ankles numerous times.
Okay. And did you ever have surgery? And from what you can remember, either when you first fell on it or the twisting motion afterwards, do you remember hearing any type of noise or any type of crepitus?
No.
Do you remember having any, again, from your first time or the second time, any type of heat or redness or swelling really?
I don't remember. I don't think so. I don't remember that. So
Okay. And so the first time you said that you were able to keep playing, but the second time you weren't able to walk or anything after that. Do you remember if there was a movement that hurt more, let's say lying down or standing up or sitting, or was it just really the rotation that was kind of
I think the rotation was probably the most painful.
mainly? Okay. And is there anything that really alleviates it? You said other than maybe the stretching?
Other than the stretch, I mean, eventually it just goes away. I'll provoke it, and then the next day or 2 days after, oh, it's fine now. I guess time and rest.
Okay. Is there anything, does it radiate at all? Or is it really
No,
just a
stays
dull,
in that
achy,
one
localized?
spot.
Okay. And normally, you said that it changes day by day on a regular basis. How would you rate the pain out of 10? Or the severity of the pain?
These are feel at all, so 0.
Okay.
And then say I provoke it,
Yeah.
a 2. And
Okay.
then it slowly goes down to a 1 until it goes back to 0.
Okay. So is there any movement that makes it go higher than 2, other than a rotation? Or does a rotation not even make it go higher than 2?
No, the rotation now is fine.
Okay.
I think, like I said before, the single leg RDLs, squatting, heavy, things like that, you could go to 2, 3, once I had
Okay. And how old are you?
21.
21?
Yeah.
And how do you identify in terms of your gender?
Female.
Okay. Do you work right now?
I do. I'm a strength conditioning coach.
Okay. Do you have any allergies?
No.
Do you take any medications?
I do not.
Do you have any past medical history that would be pertinent? Taking any medication or ever had? No. Anything in your family history that would be relevant?
My dad has osteoarthritis.
Okay.
His knees, though.
In his knees?
So I don't know if that's.
Do you have would you consider yourself a healthy lifestyle? Smoking, drinking, anything like that? And if so, happy minimum. Alright, and so are you right-handed?
I am right-handed.
Okay. And when you were playing soccer and you were playing football, are you also when you play sport, are you
When I play sports, I'm left. So I kick with my left.
okay. So your legs are left.
My legs are left.
Okay.
I play hockey, left.
With your left hand as well? Just left
Left,
hand,
like
with your left.
hockey and golf is left.
Okay.
Baseball is right. And tennis is right.
Okay. We have an ambidextrous. Cool.
Yeah.
All right, I'm just gonna rule out a couple things. I'm gonna ask you a couple of questions just to make sure that we can continue. So, do you have any persistent pain at night? Do you have shortness of breath? Do you have frequent or severe abdominal pain? Do you have any fever or any night sweats?
Nope.
Okay, good. And have you ever had any changes in your hearing?
Nope.
Okay, good. A couple more questions. Have you ever felt when it happened or since it's happened any like numbness, any tingling, or any burning down your legs or anywhere in the area? Okay. Are your symptoms bilateral, so are they on both sides, or is it just really on
Just
the right
the right.
side? Okay. And then, have you ever experienced vertigo or had vertigo? Okay, good. All right. So you're a strength and conditioning coach. How often do you work? Did you say?
Like 4 days a week.
Okay. Do you find that aggravates your pain at all, or have you found ways to kind of
No, that doesn't.
hurt? Are you
I don't really
training?
do the workout classes with them, so.
Oh right. Okay, you're just showing them.
Yeah.
Are you training for anything right now?
Yeah, I'm training for a half marathon.
Okay. Beautiful.
Yeah.
So what's your training schedule look like?
Right now I'm really focused on the bike, so I try to bike 3 times a week.
Okay.
Maybe run once and swim once.
Okay.
And I try to go to the gym 2 to 3 times a week as well.
Okay. Do any of those activities aggravate your pain?
The bike.
Okay.
Um,
Like you mentioned, yeah.
and the gym depending on what I'm doing. Like upper
Like
body
if you-
doesn't hurt,
Yeah,
but
if you're doing
heavy
exercises,
squats.
Yeah,
Like
single
if I was
leg or
doing
heavy squat or-
front squats, that wasn't good.
Okay, and do you have any orthotics? Can you change your foot, your shoes regularly, or?
I do actually have to change my running shoes, which I haven't yet, but
Okay.
I have high arches. So
Okay.
I used to have plantar fasciitis, and I had orthotics for that. I stopped wearing them. I stopped wearing them my first year of university, actually,
Okay, so about 2 years ago.
because I just didn't have the pain anymore. But
The
they
pain
said I
in your
would
feet?
grow out of it. Yeah,
From like plantar fasciitis.
yeah.
Okay. Does that affect you when you're running at all, or no?
I don't think so.
Okay.
Not that I've noticed.
All right. And when you're at the gym, the equipment that you use barbells, or do you use free weights, dumbbells, both, all of them?
Yeah.
Do you notice that you've got more pain when you're using free weights versus dumbbells, or is it really the actual weight instead of the type?
I think it's more the movement. So like if I'm doing a single leg RDL, I don't think it matters if I'm holding a barbell or
Okay.
dumbbells.
All right. Sounds good. Okay. So, I'm gonna ask you. Actually, do you mind just lifting up your shirt in the back? I'm just gonna take a look. Do you mind if I touch you at all, just to
go for it.
lower your pants? Okay. So I'm just gonna be looking to see if there's any type of like swelling, redness, anything at all, any type of deformities. And yeah, I guess I don't see anything. Okay, I'm just gonna look at your. Sorry. No, good. I got across. Okay, so those are even. And again, if I provoke any type of pain, you can just let me know. All right, and your PSIS are also even. Okay. All right. So now I'm just gonna get you. Actually, we'll keep your shirt up if that's okay.
Mhm.
I'm just gonna get you to stand up in front of me. Perfect. So I'm just gonna take a look at your posture. Do you want to just actually? I can look from here. Okay. So I'm just gonna take a look at your posture. Ooh, your right shoulder does look a little bit higher than your left as well. Otherwise, that all looks good. Just gonna take a look from this side. All right, your plumb line looks good. No abnormalities in your pelvis, tilt, or in your knees, and around your shoulders. Take a look from here. Same thing. See the high arches. And then we'll see again from the back. All right. Your posture looks good. Okay, so now I'm just going to ask you to walk all the way to the skeleton at the front. You're going to turn around and you're going to come back, just how you normally regularly would. Ooh, something's cracking.
I know.
Your toe.
Yeah.
All right, that looks good. You've got good arm swing. You've got a good gait. You've got no pain when you're doing that.
No.
Okay, perfect.
Can I pull my shirt down?
Yeah, of course, yeah. All right. Last thing, just actually, sorry, before.
No, you're good.
I'm just gonna look at the. Do you mind if I touch your spine?
Go for it.
I'm just gonna go along. Just make sure that nice and straight. All right. Okay. So we're gonna go through a couple of functional movements. You can put your shirt down if you're more comfortable with that. All right. So first, I'm just gonna have you in front of me. Actually, let me do it right here so I can look from all angles. Okay. So we can start with the squat. Yeah,
Is
just
it?
right there is perfect. Yeah. So we'll do 3. So we'll do one front, and then you can stop. That looks good. We'll put the side. Okay. One more. Okay. You can do one more.
That hurts
Alright.
a bit.
That one hurt?
A bit, yeah.
In that same area?
Yeah.
Okay.
I think it's because I worked out yesterday and I provoked it.
Okay.
So.
And if you could tell me the pain on 10?
Go on.
Oh, 1? Okay.
Yeah,
What did it feel like? Is it the same dull and achy or is it
Pressure.
pressure?
Yeah.
Okay, I'm gonna have you do a lunge in front of me. You can start with your left. Okay. One more time. Does that provoke any pain?
No.
Alright. One more time. Okay. Do you want to just do the same thing and then on the right? Okay. One more time. And then we'll do one last one. I'll just look from the other side. Okay. And how's that? Good? No pain? Alright, so now I'm gonna go through 2 more exercises. We're gonna do the ones that you said provoke pain. I'm just gonna see if they're still there, if the pain's still there. So we're gonna do actually, which one do you find provokes more pain? A glute bridge, a single leg, or
About the same.
a RDL? About the same?
Yeah.
Okay, so then I guess unless you've got a preference, we can start with the single leg glute bridge.
Okay.
Alright, so we'll start by lifting your left leg, so you can go up, and then go up in a glute bridge, and then you can come back down. How's that?
I feel it.
You feel it?
Go on.
A 1, and you feel it on the right side?
Yeah.
Alright, and we can do the same thing with the right.
I also feel it on the right.
Same pain, or a little bit worse.
1.5. I feel a bit more.
Okay. Alright. And it's again that same type of pain, or is this one pressure? This one's pressure, or is it dull?
It's like a dull pressure. Like they're all a dull pressure.
Okay, dull pressure. Alright, and then the last movement that we're gonna do together is, oh actually not the last one, but second to last one is the single leg RDL.
Okay. Yeah, I feel it as I come up.
As you come up?
Yeah.
Okay. Let's do it one more time. Okay. And how is that on 1 to 10 when you come up?
Go 1.
A 1. Alright, and we can do the other leg.
Same thing, but when I come up,
When you come up?
go 1.
Okay, so it's the same.
Yeah.
Alright, and the last one that I'm gonna have you do is to mimic the vacuuming movement that you do.
Yeah, that hurts.
That hurts?
It's like a 2.
Okay, so that one's the worst one?
Yeah.
Okay, you don't have to continue that.
It's not accurate.
Alright, and do you feel that like throughout the whole movement, or is it when you get to the end, or is it when you
When-
come back?
From here.
Oh, not in it.
Oh. Like, now I feel it. More reaching It's the reaching.
Like when
it's
you
not the coming
reach.
back, it's the reach forward.
Okay. All right, so I'm gonna go through a couple of your ranges of motion now, okay? So I think that, I suspect that you've got a problem with your sacrum. So I just wanna clear your lumbar and make sure that everything like that is okay. So since you're weight bearing, we're gonna do it standing.
Okay.
So I'm gonna ask you to roll forward, tuck your chin, and then touch your toes. And if you feel pain, you can stop or you can let me know.
No, it's fine.
No? Okay, I'm just gonna apply a little bit of pressure.
Okay.
Is that all right?
Yep.
Okay, perfect. We're gonna do the same thing, but I'm gonna ask you to extend, so you can extend with your head, your shoulders, and then all the way through your spine. And do you feel it? All the way at the end? Is it painful?
Pressure.
Just pressure? Okay. Do you mind if I do a little bit of overpressure?
Go for it.
How's that? Did it make it worse, or was it the same? Okay. Alright. And is it a 1 or a 2?
1.
A 1. Alright, so we're gonna go into a side bend. So I'm just gonna, if you just wanna go a little bit, yeah. So then you can start with, we'll start with your left. So you can just drag your arm all the way down as far as you can go. That's everything? Alright, no pain?
No.
Alright, I'll just do a little bit of overpressure there. Alright, and you can do the same thing on the other side. Do you have pain with that?
I feel it.
You feel it?
Yeah.
Do you mind if I do overpressure?
Go for it.
Alright, how's that?
I made it a bit worse.
That made it a bit worse? Okay, out of 10.
A 1 and a 1.5.
Okay. And that was your right side then?
Yes.
Alright, and then the last two that we're gonna do is a rotation. So for this one, I'm gonna have you actually just put your thighs against the table and you can use that as a counter force. So I'm gonna ask you to rotate to the left. How's that? It's okay? Alright, do you mind if I put a little overpressure? Good? Alright, and we'll go to the right. How's that?
It's fine.
Good? And overpressure's okay?
Yeah.
Alright, so we're just gonna do so we're gonna do those movements passively quickly. So I'm gonna start with your, you can go on your back. I'll just do the right side bend.
Oh, okay.
Just
Oh,
on your
my back?
Yeah, just on your back. Yeah, your legs up, perfect. Alright, so I want you to fully relax. Give me all the weight of your legs. Alright, and then we're gonna go into a side bend. That was a rotation. We're gonna go into a side bend. Alright, and passively, do you have that same pain?
No.
No? Alright. So next, I'm just gonna get a towel, because we're gonna go through your extension passively. And it might be a bit easier to do with a towel. So I'm gonna have you go on your side. And I'm just gonna put this towel underneath your legs. Yeah, so we can do that. Alright, so for this one, I'm just gonna stabilize you there. Sorry, I'm just gonna try to grab your legs. Alright, and then from here you can just relax. And I'm going to palpate along your lumbar spine. Is it alright if I... Alright, and so I'm just gonna bring you back and you can let me know if you've got pain with that.
I feel it.
You feel it? Is it the same as before?
Yeah.
Okay. Alright, so from here you can go onto your back. We're just gonna go through your, oh actually, just before that, sorry, if you wanna just take a seat on the table with your legs off like when we first started. And then we'll have your feet on the ground, so if you wanna move forward a little bit. And we're gonna go through all those ranges, but resisted. So I'm gonna have you sit up straight. I'm gonna wrap around. I'm gonna ask you to then push into my arm like you're going into flexion. Good. And then you can do the same thing for extension. Good. And then you're gonna push onto this side for the side bend. Good. And into me. Good. And then you're gonna rotate away from me. And then you're gonna rotate towards me. All right. Any pain with that? No? Good. You're off the back. Okay, so you can go onto your back. We're gonna look at your hip. Okay, so I'm gonna ask you to, we'll start with your left. Bring your left knee to your chest as much as you can. That's good, no pain? Alright. Go a little bit over. No pain with that? Alright. You can put your leg out straight, and then keeping your toes and your knee towards the ceiling, I want you to bring your leg out towards me. Is that good? Alright. I'm gonna go a little bit over. Last one, I'm gonna have you bring your leg back up, and you're gonna rotate your foot towards me. And that's good? Alright. No pain with that?
No.
So we're gonna do the same thing on this side. So you can bring your knee towards your chest. No pain? Alright, from here we're gonna do that same thing. So you can lift it and then bring it towards me. Pain? Alright. And then last, knee and toes towards the ceiling. You can bring your leg out as much as you can. Alright. Good. We're gonna redo those, all resisted. So, your leg up 90 degrees. I'm gonna push down, you're gonna push up against me, okay? And go. Good. And then we're gonna do the same thing. So you're gonna come towards me, and then I'll stabilize here and push. Good. So we can put that down. You're gonna do the same thing on this side. So I'm gonna push and you're gonna resist me. Good. We're gonna do the same thing here. So I'm gonna push in and you're gonna push against me. Alright, and then you can put your leg down. And last but not least, I'm gonna push inwards and then you're gonna push out against me. Okay?
Cool. Alright.
Alright, go. Alright. Pain with that?
No.
Okay. So now I'm gonna go through a couple tests for your pelvis. Okay? So, like everything else, if it provokes pain, you can let me know and we'll stop or we'll move on to something else. Alright, so you're okay with me touching your pelvis? Alright. So, we're gonna just do a gapping, so I'm gonna push on the other side. Do you have pain with that? No? Okay. Alright. So, I'm going to bring, I'm doing this left and right. I'm going to bring your leg up like this. Down. Alright, and if you're comfortable with it, I'm going to put my hand underneath your bum. And I'm just going to be palpating from your sacrum all the way. Are you ticklish? Hold on until your shield tuberosity. Okay, so ticklish but no pain.
Yeah.
Okay, good. Alright. We're gonna lift this leg up one more time. So you can relax. I'm just gonna place my hand underneath there. I'm gonna push down. Did you have any pain with that? A little bit? And where was the pain? Was it in that same spot?
Yeah.
And if you were to tell me what the pain was on 10? A 1? And it was again, was it a pressure,
Yeah.
a mix of pressure and dull?
Yeah.
Okay. Alright, so for this next one, I'm gonna have you side lie. So we're gonna do both sides. Yep, we can start with this one. Right. So I'm just gonna be applying pressure downwards, and again, you can let me know if you've got anything like that, okay? No? Alright, do you want to switch to the other side for me? We'll just straighten up. Well, you can stabilize yourself. Alright.
No, it's fine.
No, that was okay? Alright. And then the last one here. I'm going to have you go onto your stomach. And I'm just going to apply pressure on your sacrum. So my hand's going to be a little bit towards your bum, if that's okay.
Yeah.
Alright. Ready?
Yeah.
When I let go?
Yep.
And what would you say out of 10 that pain was?
1.
1? Alright. Okay. So I'm just going to do
Yeah. Okay. So I'm gonna have you stand up now. And we can come here. Okay, so before I do one of my last tests, I'm just going to look at your ASIS, since I did not look at that before. Right. Top. Ooh, yeah, your right side does actually look a little bit. Wait, no, that's your left. Do you mind if I just lift your shirt a bit? Okay. And then I'll come behind you. All right. PSIS. Look even. All right. So from here, we've got the space. So I'm just gonna ask you to, if you're comfortable with it, just tuck your chin, and then you're slowly gonna roll forward to touch your toes. All right. Good. You can come back. Okay. So I notice a little bit on the right side. You've got a bit of a drag. Okay. So now I'm just gonna see if your sacrum is also affected by that. Okay. So I'm gonna place my fingers. Alright, so for this next one, we're gonna start with your left leg, and I'm just gonna ask you to unlock your knee.
Okay. Ready?
Yeah.
Wait.
Okay. You started with the
I'm
right.
sorry.
It's okay. Okay, we'll go with the left.
Okay.
Okay, good. And we'll go again with the right. And you can come back. Try to go a little bit
Slower.
Yeah.
Okay.
Alright, good.
Right side.
And the right side. And you can come back. Alright. Okay. I do notice a little bit less movement as well on the right side. So, from here, I'm going to ask you to lay on your stomach on the table once again. Okay. Do you mind if I tuck your shirt in a bit? Go for it. Nice. Okay. So, as for right now, I'm just going to be palpating. So, I'm just going to actually see. Do you mind if I bring your pants down just a little bit? Do you have any pain on that palpate, or is it tender at all?
Yeah. When you push on the right hand.
Right here? Okay. Is it the same pain here?
No.
Okay, and is it the same pain here?
I still feel it a bit,
But not as intense?
Yeah.
And do you have any pain when pressing down?
No.
No. And here? No? Alright. Okay. So from here, I can see that your sacrum seems to have a little bit of a left rotation. My thumb is a little bit more anterior. My right thumb is a little bit more anterior. So for me to find out whether your sacrum is, whether it's a physiological or non-physiological torsion, I'm going to ask you to go through two movements while I've got my hands on you, or on your sacrum, sorry. So for the first one, I'm going to ask you to go into a sphinx or an extension. Do you know what that is?
Yeah.
Okay, perfect. So you can do that when you're ready. Alright, and then from here, I'm gonna ask you to come into a child's pose position so we can go slowly together. And make sure that your knees are more on the table because you're on the head. I don't want you to fall. All right. Okay. That's good. Thank you very much. All right. Okay. Okay. So there is actually one more thing that I can do. I should have said. Oh, strap.
Oh.
Buckle. Alright. Can't do that. Well, we can do that in the next appointment.
Perfect.
Okay. So since I can't, I'm not gonna be able to test your joint play. Before I let you know what I think that you've got, we can do just one more test, just to see, just to, I guess, reconfirm everything. So I'm gonna have you stand up in front of me, and then you can start with your left leg. Yeah, you can put your hands on your hips, and then I'm just gonna ask you to lift. I'm just gonna ask you to lift one leg. So you can start with your left. Just lift it up. Yeah. Good. Put it down. Do you have any pain with that? And then you could do the same thing on the right side. Any pain with that? No? Okay. Alright, so based off of my assessment with you today, I think that you have an SI joint dysfunction. Specifically, I think that you've got a non-physiological left on right sacrum torsion. So basically what that means is that your sacrum is rotated towards the left slightly, and that it likes to go into extension. And yeah. So all the tests that I did, so those 5 tests that I did on the bench were just to confirm that it was a SI joint dysfunction. Not every single one of them was positive, but you know that's how injuries work. But enough were positive, and with your mechanism, and obviously with the localized pain, it seems to be the case. And since you have no neurological symptoms, yeah, didn't want to do any of those. And no lumbar pain either, so that was good. And you passed with all the ranges of motion. So yeah, it seems to be really localized in your sacrum, which will perhaps make it easier when we do our rehab. And yeah, and also non-physiological just means that it is something that happened. It was a traumatic event that happened, but we know that because of what you told me and what your chief complaint was. And yeah, do you have any other questions for me?
No.
No? All right. I believe that is it.
Awesome.
See you in my next appointment.
Yes, ma'am.
All right.
Thank you.